strongly believe that correct information and clarity about home isolation can decline are phased drastically. Therefore, allow me to introduce our guest speaker, Dr. Sumit Khetarpal. Dr. Khetarpal is Director of Internal Medicine at Max Hospital. He holds MD in Internal Medicine from PGIMS, and he is serving as Senior Medical Consultant for the Tribune, Indian Express, and the Bank of India, to name a few. He is classified senior medical consultant and has been the clinical investigator for many drug trials. He served as a consultant for internal medicine at Fortis Hospital, Mohali. And apart from this, I'd also like to take this opportunity and welcome our CEO, Mr. Harit Mohan, who's there on the screen. Thank you, sir, for taking out time from your busy schedule and joining us today. So before we proceed ahead with this session, I'd request Harit, sir, to share a few thoughts.
Uh, First of all, I mean, thanks a lot, Dr. Sumit, for giving us your valuable time. And I think you must be very, very busy. You are actually helping all of us like a hero from the front. And, we thank you from the core of our heart to help us, indeed. So, just to give you an idea, so we would love to hear from you. There are a lot of questions participants have, shared with us. Before I, hand over the mic to you, I'll just like to quickly tell that we are a team of about 75 people. And today we have invited our team members as well as their family members and friends to, gain the knowledge from you. And they may, of course, have the questions, what they may be hearing in media or what some of us have actually, gone through in. And maybe you can take some time speaking about the topic in general, and then I have some questions, and I can we can do a panel discussion or a Q&A with you if that is okay with you, sir. Okay. I think Dr. Khetarpal, you are muted. Maybe I request you to unmute, and the stage is all yours. We can start.
Now I am audible?
Yes, sir. Yes, sir. All yours. Thank you so much.
Okay. Thank you very much. Thank you very much for inviting me for an interactive session on COVID-19. And as we all know that in our community, the COVID-19 has been basically a significant health problem. And initially, it was endemic to certain countries. Now it has taken the form of a pandemic, and a lot of people, their daily lives, their relatives, their friends, and their near family members, they are affected by COVID. And I'll not go by the common notion how it spreads, how the what is COVID-19 virus and all the thing. So I will take up the certain issues which are relevant to our society in the current time. So as we are living in a society and COVID is also living with us, so we both of us, we have to coexist in this society so that we keep our health safe, near dear ones safe, and at the same time also beat COVID-19 with our strategies. So I'll straight away go to the strategies which can help us to lead a normal, healthy life in the current scenario, so that our productive lifestyle, our productive jobs, our curriculum is affected to a least, and at the same time our health is also maintained and we are keeping safe in the current environment. So that is the main stay. And first of all, I'll like to tell you that COVID-19 is much hyped or publicized in media. Like you open up a news channel, you open up a newspaper, and you see the headlines which are filled with COVID-19 disease. So don't go by the total news channel reports. This disease, if diagnosed in a right time, or if you recognize the symptoms early in the course, so it has got a low mortality, number one. Because the majority of the COVID infections, the majority of the COVID-19 infections, we see a lot of patients in our outdoors, a lot of patients in our indoors and in ICUs. So the majority, 80% of the COVID-19 infections, they are generally mild infections, and 80% of the people, they generally recover after COVID infection. So don't there is nothing worry to panic in the public as far as the COVID-19 infection is concerned.
एडिट
Uh,
की है
Uh, Dr. Khetarpal, we request you to unmute once again, please. I think we got muted. Sorry about that.
now it is audible.
Yes, and I request all the participants to please stay muted. Thank you so much. Yeah.
So the COVID-19 is basically, as we know, that it is a coronavirus or it is a SARS-CoV-2 virus, and it is a particular affinity for the upper respiratory airways. So as any of the bacterial or viral infection invades our body, the body has a normal immunity, or which is also known as adaptive response. The adaptive response, it protects you from the viral invasion, and the viral invasion is basically part of the this uh, it goes to the viral invasion, and the viral invasion is prevented by our immune system. So in our body there is a immunity which is known as adaptive immunity. So that adaptive immunity comes into play when the viral spike proteins, they invade your epithelial lining of the throat cells. So they go into some kind of immune response. So once the body it mounts immune response, so there is development of fever, there is development of chills, there is development of constitutional body symptoms like the muscle pains, the body pains. So this is a normal immune response of any individual to bacterial or viral invasion. So the body mounts fever for 3 4 days. And what happens in normal immunocompetent adults? What happens? The immunity is so strong that it gets over the power of the virus. It gets rid of the virus. So the persons, they recover spontaneously. But in some subset of patients who have got a weakened immune response, like persons who are on the immunosuppressive agents, persons who are on steroids, persons or who are having chronic liver disease, persons are having diabetes or a chronic kidney disease or having organ transplant, the immune responses are already blunted, and those immune responses are attenuated. So those immune responses, they cannot ward off the infection, and the infection definitely lingers on more. So that is why in COVID-19 infection, we ask everybody about the age, because the persons who are greater than 60 years of age, persons who are greater than 70 years of age, they have got a weakened immune response and they cannot fight the infection as commonly as the young adults can. So persons with geriatric age group, persons with coexistent comorbidities, they are particularly at risk for the COVID-19 infections. And the COVID-19 infection, as I told, that majority of the people, they get over with the COVID-19 infection, maybe mild infection, but you should be worrisome if the person develops fever after becoming afebrile for 2 to 3 days after 5 days of onset of illness. Then if he develops persistent cough, if he has got a persistent breathlessness, and he has got persistent diarrhea and altered sensorium and low oxygen levels on the pulse oximeter. So those are the warning signs in which you have to be vigilant, and that is the time in which you have to act fast. So I'll categorize COVID-19 illness into two parts: first 6 days and second 6 days. And the majority of the people who get the infection in the first 6 days, they develop fever, they develop body ache, and they start checking their saturation on the pulse oximeter in the first 4 5 days. And it is a wrong notion to check the this pulse oximeter levels in the first 3 4 days. So everybody who is getting a COVID on the third day, they are checking their pulse oximeter, and they are telling to the doctor that my pulse oximeter levels are okay. That is a fair practice. You check the pulse oximeter readings during the entire 12 days. But the people, what happens once the fever gets over in 3 to 4 days, people forget about checking their pulse oximeter readings. And I'll basically split this COVID illness into two parts. In the first 6 days, the majority of the people will not have any complication. The complication begin to start between fifth to ninth day of illness. So why the complication occur in fifth to ninth day of illness? There is a logic behind it, and you must have heard in the media about the cytokine storm, inflammatory markers, and all the thing. So what happens once there is a viral invasion in your body, like a COVID-19 infection invasion in the body? There is an adaptive immunity of your body. The adaptive immunity wins over the COVID-19 virus, and your infection goes off. And once the adaptive immunity is not so strong, so then there is a release of certain chemical mediators. So those chemical mediators are known as chemokines or cytokines. So those cytokines, they go into a inflammatory kind of syndrome. So they go into a full blown kind of inflammatory response. And the inflammatory response in the COVID is characterized by formation of a thrombophilic state. In thrombophilic state, I mean to say that there is a formation of hypercoagulable state, and there is development of lung lesions. And if you do a CT scan in 6 to 9 day of illness, it will show opacities in the bilateral lung fields. So the common term or the common thing which is conveyed to people, this is known as COVID pneumonia, right? So they are known as COVID pneumonitis or COVID pneumonia. Actually, what happens, this is not a classical pneumonia as you see in the bacterial pneumonia patients. So these are basically the hypercoagulable state which is causing blood clots in the pulmonary veins. So those blood clots in the pulmonary veins, they appear as the patchy infiltrates or ground glass opacities in the CT. And what happens, our lungs, they are the basic filter for the gaseous exchange. And there are subunits in the lung which are known as alveoli. So those alveoli, they oxygenate the blood, and the carbon dioxide is basically expelled out. And what happens when these alveoli or the pulmonary veins, they are filled with blood clots, the oxygenation capacity of the lungs fail. And then when the oxygenation capacity of the lung fails, so the saturation of the oxygen falls in the blood, and we measure on the this pulse oximeter, which will show the low oxygen readings. So a oxygen reading below SpO2 less than 94 is worrisome. And a person, if he's having persistent cough, is having persistent breathlessness, and this pneumonia on the chest CT, which we categorize on a scoring system. So that is a candidate which needs admission. So there are two kind of candidates in 6 to 9 day of illness. One's the persons who are managed on the home isolation, and persons who are getting admitted to a hospital. So in the hospital, they get a support in the form of oxygen therapy, whether in the form of the prongs, nasal prongs, or oxygen mask, or they may be requiring mechanical ventilation or non-invasive ventilation, depending upon the severity of the or the criticality of the lung involvement. So the primarily what happens in the viral infection, in any of the viral infection, in common cold or in flu virus, what happens that there is a formation of there is formation of adaptive immune response, and then the adaptive immune response goes off. But in the COVID is characterized by a certain subset of features which differentiate it from the common cold. The COVID is characterized by the formation of blood clots, or also known as hypercoagulable state. So the hypercoagulable state, it leads to the formation of the microthrombi. So those microthrombi, they are present in the lungs. There they can migrate to any of the limbs. They can cause peripheral vascular thrombosis. So we prefer anticoagulation in in dissolving these microthrombi in COVID-19 patients. So the COVID-19 is a very different kind of coronavirus infection in which there is a thrombophilic state. While in other viral infections like in common cold or other flus, common flus or influenza, there is no thrombophilic state. So if you see any patient of the COVID in your near dear ones who has developed fever on the fifth or sixth day, and the fever is not going down, person is having persistent cough, so that is the time to get alert. So between 6 to 9 day is the basically criticality window, in which if you act very fast, so the patient can be saved 99%. And if you miss out that window between 6 to 9 day, then the patients they go into a kind of impaired oxygenation levels, in which the oxygen levels they are too low to render him awake or conscious. So that is known as that is the late stage of inflammatory response. There is a term which is known as silent hypoxia. There is a you must be hearing in the news channel also about the silent hypoxia. Silent hypoxia is basically a subclinical hypoxia, or it is also known as a happy hypoxia. So what happens in these patients, like a person of COVID, on the sixth or seventh day of illness, he doesn't have any symptom. He is totally asymptomatic. Like he doesn't have fever, he doesn't have cough, and he doesn't have breathlessness. But if you measure the oxygen saturation level, it comes out to be 84%, 87%. So those patients are happy. They don't know about the criticality of the illness. Actually, what happens, the microthrombi or the inflammatory response has reached their lungs, and the alveolar ventilation at the lung level is impaired. And such patients, they are going to far worse, and they can deteriorate in time. So that is the time. So that's why I strongly emphasize that the pulse oximeter, once you recover from COVID, or a person who has got COVID, he should not discontinue measuring his oxygen level even after 3 to 4 days of recovery. He should continue over a total spectrum of 14 days. So that will give us a very fair indication even if you are sitting at home. Even you are not even seeing a doctor, even if you are away from a place. So that is a very simple thing. And the second important thing which most commonly people do in COVID is they start steroids. So what happens? These steroids, they are basically immune modulators. They are also known as immune suppressants. So what happens? As I told you, that there is a phenomena of adaptive immunity in our body to any microbial invasion. So the immunosuppressants, what they do, they suppress the immune response, and they decrease the release of inflammatory cytokines, and which ultimately goes for suppressing the total immune cascade. And in certain persons, what happens that the immune response becomes so strong that even it is not suppressed by steroids. So on those patients, we use special drugs which you must have heard in media also, the remdesivir and the monoclonal antibodies, which include tocilizumab and atolizumab. So those are the persons or the subset of patients in which there is critical illness, and the immune response is so strong that the oxygen levels they are not maintained on the normal steroid injections. So those are the persons we use those high end drugs. And the very important message which I want to take to you all people is that the steroids should be avoided in the first 5 days of illness. Because what happens, the steroids they mask the inflammatory response. If you start steroids in the first 5 days, what it will do, it will suppress the febrile response. And there is another problem of starting steroids in the first 5 days, is that the persons are having active viral replication in the first 5 days. So if you start steroid in the active viral replication, so it will promote the viral replication, and the disease will culminate into a more fulminant kind of situation if you start steroids in the first 5 days. So there are a lot of people who are visiting their GPs, local practitioners, and what they do, they say that we have started Dexa, or we have started Omnacortel, or we have started prednisolone in the 4 day, and it makes difference. So in the first 4 5 days, you don't have to start steroids. The best logical method in management of COVID-19 is that a person is getting fever on day one, you wait and watch for 3 4 days, and if his fever comes out normally with paracetamol, azithromycin, ivermectin, which we normally give in the COVID treatment, and we wait for 3 4 days. If the saturation is normal, person is not breathlessness, person is not having cough, so he will have generally favorable prognosis. If the person is continues to having this continuous fever, person is having breathlessness, and on the fourth or sixth day the fever reappears again, so those are the persons who are into the vulnerable zone. So you can basically categorize those persons even at home, that who will be requiring a more intensive kind of treatment as compared to the other persons who can be treated at home. So for allaying your anxiety or your apprehension about COVID-19, that majority of the COVID-19 people, they are treatable, and the mortality rates, they are very low. The mortality rates are mainly common in persons who ignore the disease in the early part of illness, and who don't take any proactive step in the early part of the illness, and who don't monitor about the COVID-19 infection. So if you adequately monitor, and of course, the precautionary measures, the COVID-19 precautions, they are one part. The second part is once you catch the infection. Even if you catch the infection and if you are vigilant and you are tracking the disease right from the beginning, so you can definitely control the disease in a very methodical way or in a very systematic way. So, and if you find that the person is going into a vulnerable zone on the fifth or seventh day, so do one thing, do the inflammatory markers on the fifth or sixth day in the morning. So those inflammatory markers, they include D-dimer levels, ferritin, LDH, or the other procoagulant markers. If those procoagulant markers, they are significantly raised, so this gives you a fair indication that the disease will behave worse in the coming days. And if the inflammatory markers, they are not markedly elevated, they are into the normal range on fifth or seventh day, the disease will favorably behave. So, and if the inflammatory markers, they are significantly raised on the fifth or sixth day, then you get a CT scan of the chest done. And I have seen a lot of my patients, they come to me, they get a CT scan of the chest done on the third day of illness. They get a CT scan of the chest done on the second day of illness. So that is a wrong strategy, because by that time the pulmonary involvement on the lung involvement is not full blown, or it's not there, and the CT scan will come out to be normal. So there is a every process in which the because the total disease is of 2 weeks duration. So in the later part of the second or the second week, the majority of the complications, they set in. So that is the time before the onset of the second week. That is the time in which you can take some proactive measures so as to delay the complication or as to treat the COVID better. And as I've told you, the majority of the people, they recover by their own, and after 14 days they are totally asymptomatic and they don't have any kind of symptoms. So the COVID is much hyped subject in the media, in which they create a kind of fear mongering also. So if you are well educated enough or versed enough in which you get about the disease early in the course, so you can prevent a lot of complications of COVID in the coming time. So this is one about the treatment part. So the another thing which is coming up in today's scenario is about the prevention of COVID. So in the prevention of COVID, I'll not go into the COVID-19 basically precautionary measures in which social distancing, masking, these are very common things which are very well known to the people. I'll go into the specific preventive measures for the COVID-19. So the specific preventive measure which I'll touch in this session is the vaccination. So the vaccination which is coming in India, it is there are three kind of vaccination which is coming in India. So one is the Covishield vaccine, second is Covaxin, and the third is the Sputnik V, and which is a Russian made vaccine. So all these vaccines, they are basically they have only one phenomena in which they induce immunity to an external agent. So those immune responses, they are basically primed immune responses. So in other words, I mean to say, like if you are start doing a game, like if you start to do a cricket game, and if you do a practice match before the cricket, so you'll play cricket better. And if you don't do a practice match before the cricket on the same pitch, you may not be playing to the same intensity as with a practice match. So what happens with the vaccination? So our immune system is primed in such a way so that it recognizes the virus, it recognizes the coronavirus in such a way that your immune system is geared up to clear the virus once it attacks you. So the COVID vaccination in India is basically is recommended by government from 18 years and above. Initially, it was 45 years and above was recommended, and initially geriatric population. So 18 years and above population, they are opened up for the vaccination. So we have a Covishield vaccination, which is being manufactured by Serum Institute Pune, and with the AstraZeneca, this is one of the vaccine which is also trials in the UK also. So Covaxin is total Indian vaccine, and it has trials primarily in the Indian population. And the Covishield vaccine, one dose is given into the intramuscular deltoid, and the second dose the government has recommended is now between 8 weeks to 12 weeks. So that is the time they say that the adequate immune response is achieved. And some guidelines say between 6 to 8 weeks. And the second vaccine which is available here is the Covaxin. So Covaxin is manufactured by Bharat Biotech, which is an Indian company. And here, what happens? There is a dead SARS virus which is introduced into the body, and it leads to the development of the adaptive immunity, and those immune responses are then augmented by a viral infection and the kill of the virus. So the second dose of Bharat Biotech vaccine or Covaxin is generally given between 4 to 6 weeks. And the third vaccine, which is marketed by basically Dr. Reddy's lab. So a consignment has arrived in the Hyderabad, and there is a Gamaleya Institute in Russia, which is into the epidemiology and virology. So they have developed this vaccine, and the problem with the Sputnik vaccine is that it has to be stored in a temperature between minus 18 to minus 36 degree centigrade. So that the logistic is definitely a, challenge for them. And the efficacy rate of the Bharat Biotech vaccine is around 82%. So that is 79% Covishield, and this is close to 91%. And the difference between the this Sputnik vaccine is that the two doses they are given 21 days or 3 weeks apart. And this Sputnik vaccine, it uses two kind of vectors in different doses, and so they claim that the response, the augmented response or the immune response is better with the Sputnik vaccine. Anyhow, any of the vaccine, if available in the market, is worthwhile to take because it covers you, it gives you a shield against the COVID-19 infection. So it is basically a preventive kind of strategy in which your immune response is primed to fight off the virus in coming time. So that is one part of the vaccination. The another question which comes after vaccination is that the people who have got a COVID infection in the past, what happens? The people who have got COVID infection in the past, they have got COVID antibodies in their blood, and these antibodies generally persist after 2 to 3 months. And the possibility of reinfection in first to 2 to 3 months is very rare. Some persons they get a COVID reinfection. So these antibodies they are protective in nature, and the government has recommended that the dose of vaccination should be delayed 3 months after the recovery of the COVID-19 infection. So 3 months you are protected from the natural antibodies. And there is another this thing angle to it, because if you get a COVID vaccination within 3 months or 4 weeks after the COVID-19 infection, so that will deprive another person of the vaccine who doesn't have COVID. So because the COVID-19 infection naturally gives you immunity, so that immunity lasts for 2 to 3 months. So you wait for 2 to 3 months before getting a second this infection. And persons who have got a COVID after the first dose of infection the injection, they can also wait for 3 months. And this vaccination is these studies in the pregnant women is not are not there, and the government has recommended the administration of vaccine to all lactating mothers. So there is no contraindication as far as lactating mothers are concerned. So these are the few things which I want to tell about the COVID-19 infection. And this is the both the curative strategy, the treatment part strategy, and the preventive strategy. And as we know that this is the time in which we cannot totally isolate ourselves from the world. We can do appropriate COVID behavior, which may prevent you from getting COVID infection. And there are basically three steps. One is appropriate COVID behavior, in which you have got a preventive aspect, in which you are naturally preventing you from the infection by the usage of face masks, social distancing, sanitizing, frequent hand washing, and all the thing. And the second aspect is when these measures you take along with the specific immunization measures. So initially what happened in the last year of 2020, there were no vaccines available. So those vaccines, they have come into picture from 1st March 2021. So those vaccines, they give you a chance of developing immunity to you and your near and dear ones. So those vaccine strategy should be included in your COVID care plan. And third step, which I have touched already, is the treatment of COVID. So once if any of your colleague or any of the family members gets the COVID infection, so you have to think very logically and in a disciplined way, and you can conquer COVID. So in current scenario, if you combine all these three strategies in a synchronous manner, so you will be able to win COVID in a very invincible situation, and the near and dear ones will not be in a state of panic, or they will not be in a state of anxiety. So we are basically now living in a world in which the you can isolate totally from the surroundings. So we have to live with this infection, and we have to devise our ways to ward off this infection in a more productive manner, so that we can lead a healthy and productive life. Thank you very much. Thank you.
Thanks a lot, Dr. Sumit. I think it was uh, very nice session. I think we covered immunology of it, what we can do, monitor oxygen and the entire part, and CT scans and vaccinations also. So I have a series of questions, and they are more from the layman's, terminology. So if you are okay, maybe I can just, put some of them. So maybe I can start with the spread first. So we want,
Hmm.
of course, that the chain should be broken. So there is one
Hmm.
of the questions from our team member that, how do we effectively, break the COVID infection chain, specifically when one of the family members has been affected. And if there are children in the family, and we've been hearing about how children will be vulnerable in this wave and the third wave. So any specific tips for them?
Uh, the specific tips in a family is that once a person gets a COVID infection in a family, right? You know that the person is RT-PCR positive or COVID positive by any of the tests, whether it is a rapid antigen test or by a, nasal swab RT-PCR. You have you have pinpointed that person is COVID positive. So you have to immediately isolate that person in the home, and you have to keep his room separate, keep his kitchen separate, food separate, and don't allow him to mix in the other family members, because this is a highly contagious disease. So if a person gets, you know that the person is COVID positive, and it can transmit COVID to other of the family members. And the problem which I have seen with the persons with COVID is that there are three or four family members. They come in chains, and there is a problem in hospital also, because if your all family members they get sick, there is nobody to take care of your medical needs. This is a practical problem which I have seen in the treatment of COVID patients. Because what happens, like husband, wife, both are down with COVID. Two kids are also down with COVID. So what happens when they come to hospital? There is nobody to take care of the ill people. So my advice to people with to your company is that if any of the family member gets detected or gets positive with COVID, or is having any febrile illness which is not yet diagnosed, you take it seriously, you isolate him, and try to be at a distance from him, because it is not a matter of emotional connect, right? So some people they take it on a form of emotional contact connect that I cannot stay away from my mother, I cannot stay away from my wife because they are so loved ones. I will stay with them. This is not the time to show emotional contact connect, because with time, if you will catch infection, there will be nobody to look after them. So that is the my catch away message, that they should be isolated as early as possible.
As early as possible. Got it. So thanks for that. So the other question is, a lot of people have got infected, and what we have seen is, and this is something that I have also seen, even after 15 days of COVID, the RT-PCR gets negative. However, the mild coughs or some of the symptoms like body aches and still continue, in your body. Can I or somebody still be the source of infection to somebody else? Should I keep continuing my quarantine, or can I gradually go
No,
back to my routine?
the ICMR has a recommendation that once you are RT-PCR positive at the start of illness, and if you have completed 14 days of your illness, what happens? The viral replication occurs in the early part of the disease, right? And you are infective in the early part of the disease. The later part of the disease, you are not infective. And even if you do a RT-PCR test, even 2 weeks after the complete course of COVID, who have recovered COVID, they may show positivity. Like we have certain patients who are getting COVID positive because the companies, what happened? The companies, they go by a layman term. What they say that before joining your office, you show a COVID negative report, right? So what happens? I have seen certain persons who are having a positive RT-PCR report even after 1 month of COVID. So what happens? The COVID RT-PCR also picks up dead remnant virus. Like a dead virus remnants, they are also picked up. So even if the patient is not having a symptomatic COVID, or a person is not having COVID, his test is going to be positive. So the ICMR has now recommended that you don't get tested, retested for COVID RT-PCR after 14 days of your complete illness. So if you want to be very safe, you extend it to 17 to 21 days. So some people, they now call it 17 days. So after 17 days, there is no need to do a repeat RT-PCR testing or COVID antigen testing once you are diagnosed with the COVID on the first day, right?
Got it. Got it.
Hmm.
I think it's a wonderful suggestion for the
Hmm.
companies as well. And we have been with Dr. Sumit hearing about a lot of mutants these days, the variants, and of course, virus are all RNA in nature, and we understand. Some of us understand that they would mutate as
Hmm.
they will find a host. But how many more can we see, or are vaccines effective against them to all that have been appeared till now?
Actually, what happens? The all the viruses, they have a tendency to mutate. Like influenza virus, it also mutates. The coronavirus, it also mutates. So the mutation of the virus is basically dangerous due to what happens. There are a lot of treatment pitfalls, and there are new variants which are coming up. But the vaccines which basically utilize the complete subunit of the virus, they are effective against the mutants. Like I have given you an example of Covaxin. Covaxin is basically dead virus vaccine. It is effective against all the mutants. There is another vaccine which is the Sputnik vaccine. It also covers mutants. So the Covishield is not perfect against all the mutants, because the Covishield uses particular spike proteins or the glycoproteins which are to the certain this thing. But the coming vaccines like the Pfizer vaccine, the other vaccines, they also cover the mutants. So, and you cannot prevent the mutation of the virus, because the mutation of the virus is a multifactorial phenomena, and it can be imported also. It can be indigenous to the characteristic of the virus also, right?
Great, sure. And I think I request, perhaps I have few more questions, but if the audience who is listening to this wonderful session by Dr. Sumit, if they have more questions, you can start putting on chat. In the meantime, I cover the ones that I have. So the next question is, Dr. Sumit, plasma 19, I mean, the recent announcement by ICMR kind of said plasma 19 has not been as useful as we thought in the first wave. So,
Mm.
and it has been discouraged, but I still see some of the
Yes.
people in our company also looking for donors and worrying. So, is should they stop looking? Are there better
Yeah, they
alternatives?
should stop looking it, because the majority of the patients we treat COVID-19 in wards and ICUs, they are recoverable with good drugs like the good antibiotics, steroids, and low molecular weight heparins, and the remdesivir, and to be very frank, to be with you, that the use of very high-end drugs like the monoclonal antibodies like tocilizumab or the high-end antibiotics, they are used in a very subset of patients. What happens? The media is hyped that this drug is not available. This is 60,000 drug. This is 40,000 drug. So if you see like there is a media hype about the black fungus, the rhinocerebral mucormycosis. So these are the things which are rare. They are not like if I see a COVID patient like 100 patients admitted in the ward, I will not see even a one case of black fungus. So what happens? The media it creates a lot of hype about the various things. Although the COVID is a infection, which if it is diagnosed in a right way or in a right time, and if you institute treatment in the right time, it can be curtailed to a large extent, right?
Got it. Got it. And I was actually coming to black fungus, and I'm
Right.
glad that you've already picked it up. So, there has been a question on this also with the black fungus that it has
Right.
been apparent in the second wave. Is it just for the people who have low immunity, or has to do something with the new change in the course of treatment that hospitals have adopted?
Actually, what happens in the COVID infections? What happens? There is a subset of COVID infections which are diabetics, right? And India is basically a diabetic capital of the world also because India there are a lot of diabetic patients. So what happens if a COVID-19 infections occurs in a diabetic patients? It tries to increase the sugar levels in diabetic patients. So on the top of it, we generally use steroids, IV steroids or oral steroids in the treatment of COVID. And these IV steroids or oral steroids, they also raise the blood sugar levels. So there is a double whammy. One, the person is diabetic. Second, on the top of it, he is getting the corticosteroids. So those persons, they get hyperglycemia or the sugar levels which are greater than 300 or 400. So there is a basically fungus which is known as mucor. So those mucor fungus has got a predilection for the paranasal sinuses like near your nose or the paranasal sinuses. It grows into the uncontrolled diabetics, and there is a loss of vision and there is a fungal invasion. But this fungus it requires it grows only when there is a total dysregulation in the blood sugar control, plus there is low immunity, and the incidence is very low. And this doesn't mean that if there are 1000 COVID patients, so the 10% of the COVID patients will get a black fungus. So there is a catchy name. This is basically a fungal infection which is common in diabetics. Even in the pre-COVID era, we used to see a lot of diabetic patients with this mucormycosis. But fortunately, even in those patients, the mucormycosis is also a rare event. So this is also a rare phenomenon. This is not a common phenomenon that you should look in the every COVID patient who is recovering, right?
Got it. That's a good answer. So I think there is another question on testing that we got. So somebody says that ICMR recently launched a self-test, COVID Self, by the name for detecting COVID infections at home. Is that effective? How can we get it?
Actually, what happens? These are all antigen tests, right? So they detect the antigen of the this thing virus. The another method to test is the polymerase chain reaction. So the polymerase chain reaction, what it does? It does the genetic material of the virus. So once you go for the genetic material of the virus, this test is more accurate. So the RT-PCR test is more accurate than these antigen test. And there is another test which is known as CB-NAT or TrueNAT test. What it does, it also amplifies the nucleic acid sequences of the virus. So the nucleic acid sequences of the virus, they are amplified and they are picked up by a machine. So that is another good way to detect the COVID infection. So another way, the virus, the RNA virus or the genetic material of the virus is the most accurate method to detect the viral load in the body, right?
Great, great. And now coming to the vaccination, of course, all have been encouraging to take vaccination. Government opened
That's
18 to 45 as vaccination.
right.
What I face is a lot of people, including our company and some of my friends and families, are still very afraid. Why
Mm,
should we even get vaccination? It's a scam, or it has not been tested rigorously. Any
mm.
advice for such people on the group?
Actually, what happens, like I'll give you an example, like if you go to a rain outside your premises and you will get drenched in the rain. But if you have got umbrella on your with you, so you may not get drenched. So the vaccine is a form of umbrella, like you are carrying with you to protect you from the showers. So vaccine is the only thing which will augment your immune system to fight with the virus, because even if you don't get vaccine, you are in a vulnerable zone. So that's why the government and these vaccines, they are given to crores of people all over the world, and there is no scam involved in it. And if you get a vaccine dose, even you can get the antibody test after getting a vaccine dose to check about the antibodies. So that is a method to check whether the vaccine has been effective or not. Even if the vaccine has been scam or it have been water injections, so there will be no antibodies of formed after getting a vaccine. So if the antibodies are formed in the blood and you can measure the antibodies in a machine, so this means that the vaccine is priming your body to produce antibodies, and those antibodies, all of us know that they are protective. So I will
Right.
recommend all the people to get the vaccination, and they are all myths, and they are not right kind of statements.
Right. And just a follow-up question on the vaccination itself. We have heard cases, including the one where we lost very renowned doctor after getting both the shots. So of course
Right.
media will publicize for sensation or whatever purposes. But has this actually
Hmm.
evoked a genuine fear in mind that even after 2 doses of vaccination you're not safe? And we should not take it, or what would be your advice to such people?
I'll give you the another side of the picture. Like he's a doctor, and there are lakhs and crores of people who are vaccinated in India, right? So if we take the example of single doctor versus crores of people who are vaccinated with the various doses, so will it set an example? Like 1 in crores is what is the prevalence and what is the basically incidence? It is minuscule. So accident can happen to anybody. Like if you are sitting in a room, you go to drive a car, your car, even if it has got this thing airbags, you can with airbags there are a lot of accidents happen, and people with airbags also die. So does the car companies, they don't provide airbags?
Right. So I think it's all about decreasing the probability of the
Yeah.
mishappenings that could
So
occur.
the people who are resisting vaccination, they say that the vaccination doesn't help. So why don't they remove airbags from their cars?
Yep.
So
Indeed.
people with airbags also die.
Yes, indeed, indeed. And
Yeah.
the efficacy of the all the different vaccines have been debated. I think you already clarified that whatever vaccine you get, you should get it. Not maybe it doesn't matter about the 5% here and there.
Yeah.
Any reasons that government recently increased the span for Covishield for the second dose? Is it motivated because of the lack of production capability? And of course, logically, it will take time. We have a huge population to vaccinate, or is that actually more scientifically driven, and why this probably it
They
happened
have
now?
they have two kind of situations. One is the, of course, the paucity of vaccine, and the second is that they have measured the antibody titer, so it peaks out about 6 weeks. So they have spaced the dose to 6 to 8 weeks to get a more better immune response, so that the body goes into a kind of more adaptive kind of immune competence. So that's the logic, right?
Got it. Sure. So maybe just a few more questions. I think we are closing to the time that you have allowed us. So maybe the last 3 4 questions I'll take. What is the ideal time? So say if some of us got tested positive, do you advise them to wait for 3 months for taking their first vaccination shot?
Yeah, the government has recommended that if you have got COVID infection, because the COVID infection will generate the antibody response in your body, natural antibody response. So those natural antibodies will persist in your body for 2 months, at least 3 months. So the government advisory on vaccination has now come at with a period of 3 months. So they
Okay,
say that once you have got COVID-19 infection, you get a first dose after 3 months.
got it. And
Yeah.
about the post-COVID things, like once you've been infected, how much should we take care after the we've tested negative or 15 days from the infection it has passed? Are there any long-term symptoms towards it that we should be
There are
careful?
long-term symptoms. There are a lot of basically asthenic symptoms. Persons who are getting fatigue, persons they have difficulty in concentration because the COVID is a viral infection. It is a multi-system kind of infection, and multi-system kind of infection is basically it can involve CNS also. It can involve cardiac system also. So and persons they also go into some kind of depression. The persons they go into some kind of mental illness, and some persons they have got a hyperfibrinogen state in which you have to give a blood thinner for 3 weeks post COVID. So overall, I see that the overall recovery complete recovery goes up to 6 weeks.
Got it. And any long-term side effects of vaccination also that has appeared in the literature?
The long-term side effect of the vaccination is that the vaccination, the Covaxin, it should the data about the Covaxin is mainly in the immunocompetent adults. So
Mhm.
the Covaxin has been tested in the Indian subjects, number one, and Covaxin has not been tested in the persons with comorbidities like chronic kidney disease, chronic renal disease, or like post CABG, or persons who are having immunosuppressant drugs. So the Covaxin should be definitely avoided in persons who are having particular comorbid illnesses.
Mhm.
Covishield can be given in those persons. And the second is persons who are having allergy to any vaccine or allergy to particularly any egg protein or something, they should be careful. And third, with the vaccine is persons who are having seizure disorders or epilepsy, like persons who are treating treatment for epilepsy or seizure disorder, they should avoid vaccination as possible. So that's my
Got it.
part.
Got
Hmm.
it. And the probably the second last question is, what should be the measures taken by a COVID positive pregnant lady and who is kind of in her last trimester, and she has not been vaccinated, of course. So any particular
Uh,
precaution?
actually, there are certain studies they say that pregnancy cannot is not a contraindication for COVID vaccination. Some of the gynecologists they are advising COVID vaccination for pregnant ladies also, but the
Mhm.
government has not given the guidelines for pregnant ladies yet. The official guidelines. The official guidelines are for the lactating mothers, that it is safe for the lactating mothers. And in the pregnant ladies, there is a drug which is used in the treatment of COVID is ivermectin. So ivermectin is not used in the pregnant ladies. So azithromycin can be safely used in the pregnant ladies, and the risk to the fetus or the risk to the child is negligible. I've treated a lot of pregnant women in the second trimester, in the third trimester with COVID, and they behave favorably well. So there is no issue. But in pregnancy with a condition which is known as eclampsia or pre-eclampsia, so those are the persons who are having at high risk,
Right.
or the pregnant ladies who are having thrombophilic states, like persons who are having history of venous thrombosis prior. So those are the persons who are having a vulnerable kind of subset, right?
Got it. And then this is a final question from our side. And so the last question is that, have you seen the sudden downfall in COVID testing? Do you think that was what landed us in the wave two, and probably the same could happen in wave three also? And is there some instructions by the government on the testing every now and then?
Actually, the COVID testing is not properly utilized in India. The thing is, there are a lot of asymptomatic COVID carriers, which are basically even in your workplace or even your office or in your colleagues. And if you are sharing a cup of tea with your colleague on a table, you don't know the person sitting on the other side of the table is COVID positive or negative. So
Right.
the testing is gives you a quantification. It
Right.
gives you quantification of your disease status so that you can protect yourself and the community. So the testing should be advocated as extensive as possible.
Got it. So I think probably that were all the questions I could have asked you in the given time. And Thanks a lot, Dr. Sumit, for joining us. Completely wonderful to have you once COVID is out, and hope we can meet you
Right.
personally also after some time. So thanks
Right.
a lot. And if it is okay, do I have your permission? Maybe we can share this recording with you and other beneficiaries who would like to listen to this.
You can share. You can share.
Okay, thank you so much. Thank you so much, Dr. Sumit, and all
Thank
the
you.
wonderful staff from Max to keep helping Signicent in getting this knowledge. Thank you so much. And
Thank
have
you.
a good day, sir. Thank you. Bye bye.
Thank
Take
you.
care.
Thank you, Dr. Sumit.
Thank
That was a very insightful session. A lot of our doubts have been cleared very effectively. And we are really thankful to you for taking out your time from your busy schedule and helping us better understand COVID. And special thanks to Vijay Lakshmi and Ritesh for making this session possible. Thank you so much, guys. And thank you, sir, once again. It was a very nice
Thank
session.
you. Thank you.
Thank you.
Thank you.
Take care. Bye. Thank you.